Ми будемо розпочинати.
Dear friends, we are going to start shortly. My name is Taras Hrytsuk. I'm going to be the facilitator of the summer school, and I would like to commence the summer school to welcome you here at the Ukrainian Swiss Summer School Resilience through Cooperation. Thank you, everyone, for getting here because I know that for some of you it was not an easy journey. For some of you it was easier, of course, but we managed and we made it before we start our summer school. I have this sudden idea that was not actually discussed with our colleagues prior to announcing it, but I will take a risk here. Whenever we have an important event in Ukraine, we know that it's important that we have a moment of silence. Thank you. And some important announcements. Safety issues. So our team will be monitoring in case there is any danger. If it happens that we have an air raid alert and we will see that there is some threat for this region, we will make a pause and we will go to a sheltered space. This is the ground floor of this venue. But if we see that there are no threats for our region, we understand that it's still possible for us to continue. We will. But if it is a national air raid alert, well, if it is across all the regions and still the risk is very low, then of course you can take a decision and go to a shelter and then you can return um, when you feel safe. Also, it's really important that all of you join our chat because we discuss different issues there. You may find the announcements. If you have not joined the group yet, please, you can address our team at the reception area and you will become part of this group. There are many of the participants that we have. We have different badges. If it is a yellow color of the badge that you have, it means that you are the participant of the summer school. Then we have the purple color. These are our experts, speakers, the facilitator. That is also the same one. And the pink ones are the organizers of the summer school. This is some information for you to understand who is who at this event. We will start with opening words, and I would like to pass the floor to the manager of the Swiss Ukrainian Project Act for Health, Vladislav Zbanatsky. It is a great honor for me to be the first one to welcome you here at the summer school. I'm really delighted to welcome everyone, our leaders who work to make sure that Ukrainians become healthier. The topic of the summer school is really interesting because we speak about resilience through cooperation. We understand that acting jointly is not another formality. This is our strategic resource. This is the resource which helps us to survive, but not only to survive, but also to grow. We understand that synergy and partnership is an opportunity that really helps us to have sustainable change in such cases when you cannot work alone and you would really feel really tired without having some support. Thanks to this cooperation, we can have sustainable changes, we can have sustainable systems in the process of constant self improvement, and it's also possible for them to be active. So actually, this is part of our many Ukrainian Swiss projects that we have. We decided to consolidate the resources that we have, these efforts that we have. This is the second time when we have this unique platform available to you for training, for inspiration, for uh, communications. This summer school is supported by the people of Switzerland as DC, namely, and I would like to invite the deputy of the head of the Swiss embassy, Philippe Brugger.
Yes. Hi everyone, does this work? Yes, very well. So, very nice to be here, and on behalf of the Swiss Embassy, it's my big pleasure to welcome you to this second health summer school in Truskavec. Looking through the list of participants, I must say I was really impressed to see health practitioners from so many regions, from so many backgrounds, and really also to see how far you've traveled. And but then reading about Truskavec and strolling here from the train station, I think it's a good place to come for this kind of event. So I think it will be a good platform for constructive discussions, but also for maybe a stroll in nature, for hopefully some good nights of sleep, and maybe even some, for the brave among you, maybe even for a little water treatment or water cure, even though I'm not sure about the evidence there. So I'll leave that to you. So as I said, this is the second event of the Health Summer School. After the medical education project that took the lead last year, I'm very happy that Act for Health with Vlad and the whole team in the leads took over the leadership for this year. And obviously from the side of the Swiss Embassy, we really hope that this will continue. So this is a slight call also to other colleagues who might be interested to lead for the third and fourth and fifth and so on. Summer school going forward. And I also heard that some among you have already been here for the last edition. Some of you are new to join for the second, so I'm very interested then to hear a bit from you throughout these days, what you like, what you think has improved, maybe what could be brought back. So very nice to have this mixed group. So Switzerland supports Ukraine in the topic of health since a very long time, so since close to 30 years. And, it's always been about strengthening the whole system, making sure that all of the pieces of the puzzle fit together, and today we have this very broad range of projects, from humanitarian support to long development projects on trauma rehabilitation, on NCD prevention, on strengthening the workforce, on mental health, etc. But they are all just pieces of a puzzle, and in the end, they have to come together for the system to be resilient and for services to be delivered to the citizens across the country. And sitting in the embassy, it's always very easy to talk about these synergies and write it and say, okay, all of these pieces, they will come together. But for it to actually happen, you need to have a group of engaged, motivated people that see, beyond the immediate goals and targets and KPIs that they have, but really to understand this bigger system. And I'm very happy that in this health portfolio there is really this network and this group of people that makes this happen. The summer school also, from our perspective of the embassy, comes at an interesting point of time. As I said it before, there is 30 years that we have been working in the domain of health. And as you know, these development projects, they should always be designed so that, after a certain time, they become redundant because the system has been improved, and so that, the project itself can stop. This is why right now we are going through an evaluation, through a portfolio review that looks at, where should we focus in the future? Where can Switzerland still provide value added? Maybe what are the areas that the system is strong enough so that this partnership is no longer needed from our side. Our support is no longer needed. So I think having so many practitioners on the table this week, it's also a good opportunity for us to hear about your ideas and to use this also as an input into this discussion. Well, I would like to very much wish you a pleasant couple of days, and I would like to encourage you to be courageous, to maybe register for the session that you don't know much about. Maybe share a healthy lunch or a healthy break with someone that you don't know yet. Take a walk in the park with someone that you're curious about, and really make use of this broad network that is here. And also would really like to convey my deep gratitude and the fact that I'm very impressed by the work that all of you are doing, that it really has an impact on everyday lives of people, and that we as Switzerland, speaking from the Swiss Embassy, we're really proud to partner with all of you. So have a good couple of days, and very much looking forward to talking with you throughout the week. Thank you.
Thank you, Philips, for your kind words, for your continuous support. Thank you. Так, і колеги, оскільки ми працюємо в сфері здоров'я,
Colleagues, of course, we speak here about health. That is why it would be really surprising or strange not to have the greetings from the Minister of Health of Ukraine, Viktor Leshko. Dear colleagues, partners, friends, I would like to welcome you at the summer school of the Swiss Ukrainian projects, Brazilian through cooperation, the place where we try to seek solutions for a healthy future of our nation. We live in times of challenges. These challenges help us to understand how important it is to be in partnerships with other people. Healthcare is not only about healthcare facilities, it's self-governments, communities that we have, because it's really important to have conditions for the representatives of these communities. The topics that we are raising: prevention of NCDs, the reform of health education, rehabilitation, mental health, they are the cornerstone for the development of public health. These are those tracks where partnerships between critical sectors is really important. You cannot have quality rehabilitation without the support of local self-governments, or to think about public health without engagement of education. I also would like to give you some recommendation as based on the experience that I got when I attended the school. It's so important that you network, that you build these connections, that you get to know people from other backgrounds, because at the crossroads, this is where you will really have the strongest projects ever. It's really important that you share your feedback, your inputs. It's really valuable for our Ukraine, turn ideas into reality, because it's really important for us to have resilience at all levels. The organizers took really good care of you to make sure that you can focus on the most important thing, the development of your ideas and projects which will improve health of Ukrainians. I wish you fruitful cooperation, great discussions, strong, robust partnerships, because that is something that will really make our state even stronger and Ukrainians healthier. Glory to Ukraine, glory to the heroes. Thank you, Mr. Minister. As Philip already mentioned, we have this great place, great natural resources for us to take a break, and it's great that the Truskavets municipality joined us in this event. This is the mayor of the city of Truskavets, Taras Kulczyński. I will try to be very brief, and I would like to tell you more about Truskavets. So this place is 199 years old. I also would like to congratulate all healthcare workers, because, well, we celebrate this day. Next year, we will mark the 200th anniversary of the city. We have many partners from Japan, China, Turkey, Azerbaijan. These are resort cities. Georgia, Canciano Terme is Italy, Polish resorts, also Germany, other resorts that we partner with for many years. Troskavets is the only resort city in Ukraine, which is a member of the European Association of Thermal Resorts. So actually, you can say that partially we are in the European Union, though it's still a journey that we need to make. It's important for us to have higher standards, not just copy paste them, but to promote what is ours, what is Ukrainian, our health related practices. We have 15,000 baths, so more than 100 facilities. 1,500 of them are related to the provision of services to the military. And we also have some 10,000 beds in private sector. It's been 5 years of this war. We have 11,000 IDPs in our community. I already mentioned about the number of beds that we have. And of course, that we understand that people flee their homes, and it's safer here, of course. While air raid alerts are still here, but of course, we are not under constant threat as it is in other regions. That is why people who suffer from some physical issues can get some treatment here, as well as mental health treatment. We also have people who come here for 2-3 weeks, and we have IDPs, and it means that this is quite a load for this community. That is why I suggest that you can even study the situation. We have 18,000 loads. We are extremely resilient, and we got used to the situation already because of the current reality. The World Health Organization conducted a study. There was a survey. We thought that 10% of population has mental health issues, but now it's 20%, and we understand that this is quite an indicator. Well, we understand that we can all have some issues, so to say, but it's really important that you are ready for different situations, different circumstances. You will cope with everything if you stand ready, and it's important that you can support people, that you can support practitioners, those who are involved in providing of services for mental health, physical health. And it's very timely for us to consider all these issues. And thanks to the Swiss program, as well as other grant programs of international partnership that we have, I think that maybe at some point we'll also receive support from the state as well, because, well, we see that the state does not respond to the request that we have when you consider the nature of our community, that this is a resort, because this is how it is in Europe. The support is there, but we know that it's important actually to support people, not to make money because the people have needs. That is why it's important that we support everyone and provide the help needed.
Everyone knows that we have not only 15,000 beds in Truskavets, but you can also walk many thousand steps in this beautiful park here. We are holding this school here in Truskavets for you to get inspired by real stories of cooperation, of partnership, and for you to start sharing with each other. And it's important for someone to start telling their story. And we now would like to invite all our Swiss-Ukrainian partnership projects to start sharing their projects. So we'll start with the healthy workplace, which CDC is involved into. It's implemented by the Ukrainian Catholic University within our Act for Health project. So I invite Natalia Ivanchenko, the main sanitary doctor of Lviv region and the head of the Lviv CDC. Glory to Ukraine. I am Natalia Ivanchenko. I used to be Timko. And I would like to tell you my story, the story which started from Facebook. I saw an announcement about a competition to hold a school called Public Health Leaders, and I just became the head of the Lviv CDC, and I knew that I had to change everything and do something that nobody did before. So I filled out the application. And in about 3 weeks, I found an announcement on Facebook on public health schools. So I didn't know whether it was the same or something different. And I applied for the other one. I got a refusal in one case, but I was invited in the other case. And this training was a very good starting point for me because I realized what tools I could use. What did it all start with? Every day we started with some physical exercises. The last one was rain in Lviv. I will show you this exercise later on. And when I got back to work, I just have 1,000 of employees. So we start every day with exercises and we do the rain in Lviv exercise every day. So this is a very good opportunity for everyone to do something together, regardless of the weather. If the weather is too bad, we do it inside. And this is what the Public Health Leaders School inspired me with. We also give prizes, we conduct questionnaires, and it all works very well. Just to make our life a little bit more interesting, we also do the Nordic walking. And it's good that we have these team building activities. There's no health without mental health. And since everyone has their own problems, we invite psychologists. And the most important thing is for us to understand that we need to prevent and work on the prophylaxis of mental disorders and not just treat something when it is there. And during my studies at this public health leader school, I realized that whatever you do should start with yourself, and your workplace should not be the place where you're losing your physical and mental health, but this should be a place where you can even gain it. And that's when we started creating our own healthy workplace. So we used to bring sandwiches to work. Now we have a fridge, a microwave, and people can bring normal food and eat it at work. We now are encouraging people to eat healthily, so they exchange information about a healthy plate and so on. Then we started cooperating with the Ukrainian Catholic University very actively. We signed a memorandum of understanding, got inspired, and we realized that the things we did for ourselves in the conditions of limited resources can be shared with those who have unlimited resources and who can actually create healthy workplaces. So together with the Ukrainian Catholic University, we visited 17 companies, and this is not the end yet. So we've been not only sharing what we have done in our organization, but we also conducted all possible tests, measured whatever could be measured. We brought the nutritionists with us. We found people with diabetes mellitus, people with high blood pressure. We helped them understand what the right healthy plate is. And people meet us in the street and say, you visited our company and you told us about healthy eating, and I have lost 3 kilograms and I'm going to continue. So thank you very much. What have we faced with? We realized that we need to talk about very simple things. There are coffee machines everywhere in the companies, and people drink a lot of coffee because they want to drink something. And where are the coolers with the water? Wherever they have the coolers, people drink more water, and well, there's fewer problems with high blood pressure. And we want to make sure that people eat healthy, and but they don't do it at at the table they work at, but so that they have a dining space. And we also want to create a room for staff relaxation. What is even more important, because of all the inspiration I got from the public health school, I realized that when you have a goal and when you are inspired, then people get inspired as well. If the leader doesn't care, nobody else will care either. I liked Peter Zashev from Finnish University, who said that, if you are like a dead fish, you cannot inspire anyone. So, well, please get inspired and inspire the others. It really works. Thank you, Natalia. Are you inspired already? All right, let's continue. And I would like to invite our partners from the medication project, Jana Chernysh, who is the head of the project office in Ukraine. She also works at the healthcare school at Kyiv Mohila Academy. The floor is yours. Hello, everyone. I'm happy to see you all here. Taras shared his observations in the beginning. And actually, he almost said the things I was planning to say. He observed that we have here many people and everybody has a badge. And I would like to speak more about that. And I would like to say that people here in the room most probably don't work alone. We work in teams. Why do we work in teams? It's because a team can do much more than a person alone. And it seems to be that in parallel, very big changes are taking place as well. We are going beyond our teams. And I guess that is why some of you are here, because you are interested in what is happening outside of this bubble, what your partners are doing. And as Natalia, we may be building our organizations and making them stronger. As Natalia, as Vlad, and the other Swiss colleagues, as they build the teams of the Swiss projects, we do not only build our own teams, we also look for strong partners. We implement joint projects. We look for people who have a different way of thinking, and we try to combine the experiences which have never been combined before. These are our professional bubbles which stop competing and start intersecting. And at these points of intersection, we get something new, something interesting, and something unique. And I think that the reason for that is very atypical. The systems we work in are very complicated. Education is complicated. Healthcare is complicated. Communities, universities, hospitals are complex systems. And when we talk about people, about their relations, about their trust, about their motivation, about the changes, these are the things the philosophers call super complex systems. So how do we implement changes in these super complex systems? Almost nobody knows it. And those who know and suggest and offer you a magic pill, that those are not people to trust, because we know that populist solutions and magic pills do not work in our complex conditions. And I feel that a lot during summer school. So we started organizing back in 2013. Victor mentioned the minister mentioned his experience of participating in summer schools. I don't know how it happened but when we organized the first summer school, we worked with Natalia Ryabtseva, who was in charge of the mother and child health project. I think that many of you know about it. Pavlo Kovtoniuk worked at the healthcare school of the Kyiv Mohila Academy at that time, and he also was the editor of a journal about management in healthcare. Few of you may remember the journal, but you may find it in the libraries, and I do recommend reading it because there are many articles which remain topical today as well. So we selected the first group. It only had 25 participants, and we organized that school in Pilipet. Our Swiss colleagues, and that was in December 2013. You remember what happened in December and in February 2013. So our Swiss colleagues said, friends, what summer school are you talking about? You will not be able to do anything in your country because your country is very unstable. Well, let us think about organizing it later. But we didn't plan on organizing it in the Crimea, which saved us a lot. We planned on organizing it in Pilipets, that's Carpathians, and we did organize the school. And Mr. Leshko was there. He was an infectious disease doctor at that time. We also had Natalia Kalmakova, who just finished her cadence as the minister in the matters of veterans. And we organized the project, which actually had very good results in the long-term prospect. And that tells us that we live in a complex world, and the investments we make today may not show you the results tomorrow, but most probably we will see the results the day after tomorrow, in 5 years, in 10 years. But those who work with education, because very often education is something that changes the systems. Those who work in education, they see that these changes are taking place. And when we speak about healthcare, it's not only about the diagnosis, and medical education is not only about clinical knowledge sharing and about treatment. It's about the way people live, the way people take decisions, whether they trust us, whether they trust you as organizers of the event, how they interact with the system, how they support instead of controlling, how they suggest partnership and refuse from paternalism. And I think that this is the basis for all summer schools and those winter schools which took place starting from 2014. And when Natalia said that everything started from Leaders for Health, I think I could say that it all started even before that, starting from 2015, when we started organizing winter and summer schools together with all the partners, including UNICEF and the World Bank and many other international and Ukrainian initiatives. And throughout this time, we've been inviting people and selecting people, not looking for people who are like-minded, but what is important for us is to find people who actually think, and people who can think together, because together we can find many good and new ideas. So I wish you that this cross-pollination takes place during this event, just as it took place during many previous events, so that you don't just share your experience, but you come up with new ideas and have a new network of acquaintances which will be supporting you for many years ahead. I don't know whether Vladislav and colleagues are actually calculating how many future ministers of healthcare are in this room. Well, not necessarily healthcare. We may have other sectors represented here, of course, ministries of defense or other ministers. I think that it's due to platforms like this one, which is resilient and is built through cooperation in the Ukrainian context, starting from 2014 with the support of Switzerland. Well, maybe in another 13 or 14 years, we will meet at another European resort, which will be the part of the European Union, together with the Swiss resource, maybe, and we will be recalling how great this summer school was. Thank you, colleagues. Do you understand all the hopes that are imposed on you? We'll check what happens in 10 years. But we'll be very happy if you achieve these results earlier than that, maybe next year or in 2 years' time. Colleagues, and now our colleagues from the project Rehabilitation of War Traumas for Ukraine will tell us how partnership helps in their work. And I would like to give the floor to the Associate Professor of the Labor Therapy Department from Zaporizhia. Hello. I'm very happy to be here. Our initiative is probably the youngest Swiss initiative. We started our work on rehabilitation in 2022. And the true initiative was a logical continuation of the RDV initiative. I can't tell you anything about 2013, but our cases and our experience of partnership, this is something I can tell you about. We tried showing you a picture of partnership, how many partners we have and how we are connected, but we failed at doing that because everyone is connected with everyone and we cannot even recall everyone and mention everyone right here and right now because these are professional communities, these are the support services, these are private institutions and state-owned healthcare facilities. These are the international experts, but all of them are united by the patients because the patients are in the focus of our attention for all of us. In any partnership we have, no matter how we cooperate, the biggest value is the value we hold very dear to us, and that is that every and any patient in Ukraine should get high quality, accessible rehabilitation support. And now I would like to draw several examples of the cases which I would like to mention and which I actually have time for. Face the future. Roman, actually went to war when he was 18, and he was heavily wounded near Kursk. So he got support thanks to our project within the framework of the initiative, where we have international experts from Canada and the United States, where we have many Ukrainian surgeons and surgical nurses who undergo training all the time and who have been doing reconstructive surgery since 2022. And Roman was one of the patients who received their help because the patients are always in the focus of our attention. So this is one of the initiatives of ours. Support of the international community. We keep telling everyone and everywhere that rehabilitation is developing thanks to the development of the workforce, and no matter how good international experts are, we have to develop our experts.
Rehabilitation starts at intensive care units. That is why we understand how important it is to cover this area. We have Daria, who knows a lot about this part of physical rehabilitation. They work a lot in this direction in Dnipro. Many specialists participated in a training program. We had British partners here, and this is the support that we have. It's also rehabilitation in cancer, other diseases, and thanks to these partners, it's possible for us to grow. There is another case, Save Dnipro Protas. This is another initiative. So this is public, a state healthcare facility. They produced up to 1,000 prosthetic devices per year, and they were on the lookout for partners. It was really important to have an communication campaign for this facility to remain a state one, not to be sold, so they keep providing support to our defenders. Case management services. We have 17 partner services that we cooperate with. In most cases, these are Ukrainian experts from public, private institutions. They cooperate to optimize the pathway of our military, because we understand that it's not always optimal what we have offered by the state. It's important for us to ensure great results and high quality. That is why it is also one of our objectives to make sure that patients have high quality of support and help provided to them. In 2026 alone, we already had 120 requests from support services. As I already mentioned, the state sometimes cannot provide the optimal support. There are many private institutions happy to support the military. That is why this cooperation helps to optimize the pathway. This is Sergei that you see in this photograph. There was also a physical rehabilitation doctor. We will have workshop with Artem tomorrow. And of course, we understand that that was a complex case. So there was no promise given to the patient that the mobility of joints will be back and that he could move. But actually, thanks to the rehabilitation, he's back in the army and serving the state. The last case and one of the last initiatives, the most recent initiatives that I would like to expand on, we already had more than 2,500 therapy sessions working with speech, the therapy of speech provided to veterans who sustained traumatic brain injury. So this is Dmitro. He sustained TBI and he couldn't recall his name. He couldn't talk, but now he works in a barber shop in Lviv and he has no problem with communication after the treatment he underwent. So this is the QR code, and also in your handouts you can find this information as well. Also, I would like to express gratitude for having me here. I also would like to wish all of you to have some takeaways, to make partnerships, to make connections, everything that will incentivize you to grow and to develop. Thank you, Tatiana. Thank you for your contribution, for your engagement. And there is another great example that we have I would like to invite Orest Savala, Mental Health for Ukraine, also Margarita. Glory to Ukraine, glory to the heroes. I am sincerely grateful for being present here. I would like to tell you more about the Ambassadors of Mental Health initiative. It is supported by Mental Health for Ukraine project. This is also a Swiss Ukrainian project. So it covers people of different backgrounds, different professions, but the uniting factor for all of them was a mental disorder. And now this is a possibility for these people to speak more about their lived experience. It is about this human-oriented, human-centered approach. These are the people who share their challenges, share their stories. This is an opportunity for them to be heard, and also is about the feedback that we can have. We set up an NGO this year, Ambassadors for Mental Health. We have 4 tracks. One of the areas is peer-to-peer support groups. This is a network that we have where we have people living with different mental disorders, then supervision and intervention sessions is another one. The third one is awareness raising. We can, if you have any ideas, we are happy to tell more about our initiative in educational facilities. We have our team representatives all over Ukraine. Also, some people, they were service users, but now they are trainers in different programs, the World Health Organization programs. We participate in different projects, roundtable meetings. Our community has very good understanding of all those people who really understand how the patient pathways work, because we know it from the inside. All right, so probably it's time for me to pass the floor to Oris, but I would really like to thank you for this presentation. Thank you for being so brave and for being so confident that this is the cause that people really need, because while we represent mental health for Ukraine, Swiss Ukrainian project, we started back in 2019, and actually in different communities under different conditions, different activities. We cooperate with very many of you who are present here, and I hope that in the future the number of these people will only grow. But in healthcare, especially if it is about mental health, we know that there is this kind of special treatment, prejudice, fear, stigma. Very often, people with lived experience, they are not part of this discussion, and we understand how important it is that they are there. But our colleagues, Margareta, people from different regions of Ukraine, they decided to create an NGO, and they could be of great help to us as professionals, to have an even deeper understanding how to shape these services, how to provide the services, what is the connection between all of them. So thank you for your very active stand, for your initiatives. And this is another great example of cooperation that we have, joint efforts that we take, and joint contribution. We speak a lot about an ecosystem of Swiss Ukrainian products. Petro Ilkiv, who's not here, but he is also an initiator and advocate of the Swiss Ukrainian initiative. He speaks a lot about ecosystem because it's about social services, education, veteran affairs, communities, local governments. And let's not forget about service users, of course. That is why on my behalf, I would like to wish that you leave your professional bubble and get to meet other people from different walks of life, different backgrounds. When sometimes we do not clearly understand who is doing what, especially when it comes to mental health. It happens quite often that we do not know about what other people do. I also would like to express gratitude to Act for Health, because they are the leaders when it comes to the organization of the summer school this year. Thank you for this great partnership that we have. And I hope that these 2-3 days will be a great opportunity for this initiative to grow. I wish all of you to have a great experience here, and I wish all of you to enjoy the summer school. Thank you, Oris. Thank you, Margarita. So probably it's time for us to draw some conclusions after the greeting words, some experience exchange of partnerships that we have already built. And I think that one of the key takeaways is that it's really important to have visionary leadership for the art of partnership. That is why sustainability in different domains, not only in public healthcare, really depends on those people who can see beyond actually. And even given the fact that there is a lot of uncertainty right now, this is what we are cherishing right now. This community, this leadership that not only knows how to respond to some crisis, but it's about the tradition and experience that is passed. we do not only receive support, Ukraine is a global contributor, not only a receiver. That is why our experience is an intellectual capital, and this is what the world can benefit from for many years to come. We really reflect on the experience that we have to understand what can actually work, but we understand that the backbone is people. The sustainable system draws heavily on strong professionals, protected professionals. That is why it's really important for us to invest into your well-being, professional growth. It's so important for us to take care of those people who will take care of other people. That is why the summer school is the space for your reflections, innovations. This is actually the time when you can take a break, when you can just look around, just to get to know people surrounding you better, to try to understand who's doing what and how you can mutually contribute to each other's initiatives. So to get inspired for the next month or maybe for the entire year before we have another iteration of our summer school, I wish all of you to enjoy these days, these hours, for them to be a unique experience for you. And yes, I think it's high time I pass the floor to Taras to make sure that we have great reflections and there is some interconnection between everything that we are discussing. So Taras was the first one actually to open the event, but he is the coordinator of educational projects. He has more than 15 years of experience of facilitation. He is also a co-founder of the organization dedicated to education. I would like to express gratitude to Vladislav, to all the colleagues for your presentations, for your greeting words. As Natalia already announced, the summer schools are never without physical exercise. So that is why it's time for us to have some activity. So this is a solution of our colleagues, Act for Health, Swiss Ukrainian Project. So what's the plan actually? This is a video recording of an exercise. You need to stand up, those of you who can. So we will play the video. Everything will be clear. You will understand what you have to do. Just try to repeat, yeah? Be kind to yourself. Try to repeat everything that you see, these movements that will be played right now. Let's have it on. So we will activate our power. Green salad, tasty fish. We cook it. Tasty egg is healthy protein. We have tasty fish. They are in the plate together. 1, 2, 3. Have your hands up and down. Now smile. Eggs, salad, juicy fish. This is the energy need that we have. Nutritional and healthy food for our immunity. 1, 2, 3. Now move your shoulders. Have your hands up. Smile. Egg, salad, tasty fish. This is what we have in our plate.
І сила, зелений салат, це барвиста і яскрава хвиля, соковита рибка, це розум і краса, всі разом в тарілці, справжня дивина. 1, 2, 3, плечі підвели, руки вгору вниз, нумо посміхнись. Яйце, салат, соковита рибка, це наша енергійна потреба, корисна їжа для нашого імунітету. 1, 2, 3, плечі підвели, руки вгору вниз, нумо посміхнись. Яйце, салат, соковита рибка, це корисна помилка.
So I am a mic holder, and I would like to say that this will be a regular exercise for you. And at night, you will be thinking about this tune because of how many practice you got here. Yes, thank you, Act for House, for these great ideas that you have. So subscribe to our social media, and not only, you will find even more information there. So now it's time for us to, after this physical activity, to have an informal introduction. So you need to use your mobile phone for this activity. Check whether you are muted. Yes, it's really important that you're on mute, because it could be distracting for us if you have the sound on. This is our joint area, the general area for all of us. It means that there will be some events for everyone here. Sometimes we will divide this space into parts. When we will have parallel workshops, there will be 2 entrances in this area. Well, you will see. At 15:30, we will have a healthy break. At 16, we will be back. Maybe some of you didn't have enough time to check in. You can also use the time for the healthy break, of course, to take a break, but also to check in if you still need to do that. At 17 today, there will be another joint activity here at the same place. We will sing together. And at 7 o'clock, we will continue getting to know each other better. And actually, about singing, those of you who think that you cannot sing, you will sing. It's easier. Then at 7 in the evening, there will be a joint dinner. The 9th floor of the hotel. We will continue networking. What else is important? Your notebooks. Now you will need to use your notebooks, and I will describe what you have there. You also have pens there. We need to sign our notebooks. This is page 1. Make sure that you indicate your first name, your surname, because all of them are identical, and if it's not under your name and you misplace it, it will be difficult to find it.
Так,
If it happened that you do not remember your name is also written on your badge. So these, well, notebooks, workbooks that you have, this is a creative, useful tool where you can put down your ideas, reflections, observations, any agreements that you make as far as new partnerships are concerned, contacts. This is a practical tool that will be of great use for all of us during the summer school. So the agenda is there, all the information about partners, organizers of the summer school. I suggest that we all open page number 14. And there is a question that you will find there. What do you want to keep in focus of attention during the summer school? This is an individual question that you can reflect on personally, of course, because all of you had certain expectations when you arrived here. And take a moment, take a pen, and put down what do you want to focus on during the summer school. Put down your expectations.
можна
You may start. our next lecture. So I would like to invite our next speaker, Oleg Romanchuk, child psychiatrist and psychologist who represents the Colosimi, the Family Circle Center in Lviv. And his lecture is called Resilience Through Partnership. So, Oleg, the audience is waiting for you. Thank you very much. Dear colleagues, thank you for the invitation, for the opportunity to be here in this nice place where we have so many good people. I came here with my wife, so we came in and we sat down and we realized that, you can feel the place with good people very quickly because this is a source of power, this place of power. And it's very good when we have good and big dreams together and when we want to do something big and important together. I really like the format of summer schools taking place somewhere outside of the city. And for many of us, this means that we can step aside from our regular lives and see how big the world is outside of our bubble, as we call it, how much of other different things are there. And I really like summer schools because, summer is a very good time of the year. And I don't know about you, but for me, there's no summer if you can't spend some time under the starry skies and light a fire and sit down in a nice circle. So I asked the organizers whether I could speak without the slides. And I was thinking, and I decided that I would like to have these immersive slides, the ones which we create in our own imagination. So imagine you're sitting under a starry sky, and we sit in a circle, and there's a fire in the middle, and a very pleasant silence. And this is the place where we can remind ourselves that school is a place where we are pupils, students. We all have children, we teach others, but the school reminds us that we have to remain students throughout our lives because a student is a person who knows something but doesn't know another thing, someone who is curious. And what is important here is that you're striving for new horizons because there's something you haven't seen yet and you have good and right questions to ask. So I wish that the school becomes a place for you where we can sit under the starry sky in this circle around the fire where we can discover something very important. And during my speech, I would like to invite you not just to listen to me as a lecturer, but to reflect on two topics. The first topic is resilience, and the second topic is partnership. So let us start with resilience. I know that the word and the notion of resilience is very interesting, and I think Ukrainians are very interesting because they resist to foreign terms significantly. Because in English, we just use the word resilience, and everyone knows this word all over the world. People know that there's mental resilience, there's institutional resilience, financial resilience, and so on. So we are speaking about resilience here as well. We understand that many terms which speak about something very nice need to sound poetic in Ukrainian because otherwise they seem like they are deprived of life. And that's why in Ukrainian we call resilience життєстійкість, although when you write a dissertation you indicate resilience as a term. But it is how it is. And I don't think it's by accident. It's that when we call resilience життєстійкість, this is important for us, especially at these times when we face the destruction of war, the war which destroys lives. This resilience, this is the power which helps us recover, rebuild. our lives and remain alive and live in the deepest sense of this word, as you know, as David Lawrence says, that you need to keep living even if the sky falls. And the word resilience came into our discourse quite recently, although it's been with us for forever. I graduated from the medical university in 1990s, and throughout the studies, I have never heard the word resilience. Then I studied psychiatry, psychotherapy. I didn't hear the term either. And officially, I finished my formal education in 2004 as a psychotherapist, and I never heard the word resilience, although now we understand that this is one of the most important things. I remember that back in 1996, I wrote my master's essay, and I had to research how parents respond to when a child with disabilities is born into their family. And I reviewed literature, and I could only find pathological reactions like depression or parents going from one doctor to another, or anxiety and panic. But no one mentioned that parents may be okay and their response may not be a pathological one, because in medicine we usually focus on what is wrong because we are trying to help with the diseases. And I was a young specialist, and I had to interview the families bringing up children with disabilities. So you come to these parents and you expect like depressive reaction or nomadic reaction, or panic or something else, but you come and you can see happy people who love their child. They say, yes, life is hard, but we love our child and we will do everything we can for the child to be happy. We do realize that the child will never be able to walk, but we want to give them a good life, and we need to change the society for that as well. So I remember there was a family, the parents, I sat with the parents, we drank tea, and the child was born prematurely. She had a severe form of disability, and I asked them, I was very touched by their reaction, and I asked them, what helped you? So they smiled and they hugged each other, and that was it. So that's what I realized. So the resilience was based on their relations, and I needed a story, and I told them, but tell us something. And then he thought, and this father tells a story. At that time, fathers were not allowed into the maternity hospital, so the mother actually passed a note to him that the child will be with severe disability, and he didn't give her a note back, but there was a lot of snow, so he wrote, we will keep living on the snow, so that she could see that. And I think this is a story about many people in Ukraine, people who, despite all the difficulties in their lives, they still write the road of resilience with their steps on the snow. And it may seem to us that it has only appeared recently, or we have started to understand it recently, but if we go deeper into our history and culture, we will find not only the history of traumas there, but we will also find there the history of humanity, resilience, and how people kept living despite all the historical challenges we know about. During the COVID times, everyone was talking about vaccination because vaccination was a solution there. And now when the war is destroying our mental health, and when the enemy understands that to prevail over us, they need to demoralize us, to make us panic and so on. So we understand that the response to that, both to the informational war and the impact of the war on our mental health, is the resilience. So we know that resilience is invaluable. This is just like that vaccine which protects you and which solves a big problem of COVID. So this is something hugely important, super important. So I would like to invite you to reflect on some things. So I would like to start by saying that this resilience is present there and it's of great value. You can remember, well, the words of Lesa Ukrainkas, who said that the one who has not lived during the storm does not understand how strong they are. So the question is, where does resilience come from? And since this conference is science-based and evidence-based, so let's go and ask what science actually tells us. When different diseases are studied, and for example, PTSD was researched, and at some points, researchers were very much surprised. For example, in New York, after the 9/11 incident, everybody thought that everyone in New York will have PTSD. So they opened free counseling, free psychotherapeutical practice, but the offices were empty. People didn't go there. It wasn't because of stigma. It wasn't because of it wasn't affordable or accessible, but it was because most people are resilient, and that resilience is connected with the resilience of their families, communities, and teams. And 5 years after this terrorist act, they presented the results of this research at a conference in New York, and they actually said that the results showed that the most important thing here is resilience. And the same goes about parents of children with disabilities, victims of and witnesses of tsunami, and many other things. And all this research tells us that resilience does exist, and it's very widespread. It's not something surprising. And we also understand that from the point of view of research, resilience as one of the researchers said, does not have any secret components. The formula of resilience is very simple. It's not rocket science. It's human relations, values, resilient thinking. It's acting together, collaboration, hope, choice, and so on and so forth. These are very simple things. Unfortunately, there is no vaccine and no pill that will provide you with resilience. Resilience is a combination of everything in one person, everything that you can also get from the relation from other people. We all are born with a system of resilience, and it can be brought up. But I guess the most important thing we can learn from science is that wherever you find resilience, you find relations. And very often, these are not any relations, but these are very strong relations. And when we speak about resilience, these are the relations that will support life. And all researchers say relations, relations, relations. And they say we can actually summarize that they say that human nature is very resilient. We don't have to, exaggerate, because everyone has this breaking point when but people are resilient when they are healthy and in healthy relations. In that case, people can withstand a lot. And now we can speak about the second topic. If we understand that resilience is important and it depends on the relations, then what relations lead to resilience? On the one hand, we can say it's about unity. We have to be united, and it can sound as a motto, and it may be scary for some of us because we remember the Soviet Union, and the Soviet Union collectivized not only the lands and the cattle. They wanted to collectivize and unite all people. Well, look at Putin and what he's been talking about in the last week. So he's been talking about the national unity for the sake of war. So there is certain unity in totalitarian systems. They want to have a strong totalitarian system. But this is not the kind of relations we're talking here about. When we speak about the relations which lead to resilience, so we need to understand healthy relations, because we usually say, well, there are toxic relations, there are relations which you have to flee from as quickly as possible because it's about exploitation, abuse, and so on. So we have to have a look at what is the characteristic of the healthy, life-giving relations. And we understand that those relations are life-giving when they have respect to people, when you can see people, when a person is free, when they are care and solidarity, when there is mutual support, when there is trust. And these relations are not easy to build. And we like using this term to say that when a group of people has relations like that, we tend to call it a community. So we actually kind of started reviving the old world because we used to think that a community, this is a kind of a religious sect or something like that. So who are these people? What do they want from us? They probably want to get something from us, and this is the place where we can lose our identity. So I would like us to look at this phenomenon of community right now, of what we call a community. Relations within a group of people give us resilience when people create a community. This is like the carbon atoms. When they are separate, it's, graphite. It's a pencil, and when you press it against the paper, it falls apart. But then it may also be a diamond, and diamond is one of the strongest crystals, so you can cut glass with it. So there has to be a certain configuration of that molecule. And the two most important messages I would like to tell you, and the ones we will be looking closely at right now, to understand that the strength of people is in the community. The community is the key. And this first message leads us to the second message, that we have to be very wise in working on the communities and in building Ukraine as a community of communities, where communities are united by partnership and collaboration and action. So let us look closely at resilience and why it depends on relations and what good relations are. So the first answer results from the research into child development. The best thing a child can get during their childhood, something that will have a positive impact on their whole future, something that gives them the biggest chances to be resilient, have mental health and well-being. This is what is called secure attachment. We have a whole basis of scientific research which shows that these relations with parents is the biggest blessing for the child. And we understand that the human nature is such that when a child is born, they have this very long fourth trimester until they grow up. And they are actually like borrowing a lot from their parents, when they don't have their own coping mechanisms and other things. They join the parents' psyche through social synapse, and they learn many things which help them grow and develop and become resilient. And one of the things which is very illustrative here is that during the Second World War, some children were evacuated from London to the villages because London was heavily bombarded. And these children were left without parents. There were no bombardments in the villages. Some children stayed in London with their parents, and the research shows that paradoxically, those children who stayed with their parents, even though they were in bigger danger, they had better indicators in terms of health and their resilience, because their first shelter is love and support and protection, including mental protection of their parents. And I think that we have seen it that so many times in Ukraine, as a child psychiatrist, I will work with different families, like a family from Mariupol whose father died and they barely could evacuate, and now they live in Lviv. And you conduct an interview and you're looking for PTSD signs, or you have a teenager girl who's left from that there 3 years ago, and you look for the symptoms, but you cannot find any. And I I'm surprised all the time. And when I ask, what are your reminiscences, memories about that month? And they say, yes, I have bad memories, but also have some good memories. And I cannot understand how can you have good memories about March 2022 in Mariupol. And she said, we sat in the basement. It was dark there, but my mother was hugging me. She was singing Ukrainian songs to me. My father was helping me think about the future. We were imagining a lot. And I was feeling enveloped in love. So it's very important to know that we share our resilience as we share other things, because this is human nature.
Користали
The human nature, it's really important that we draw on the mechanisms of coping of each other. We have these connections and we are united as a system. We are born with this skill. And we need that not only when we are children, we need secure attachment throughout our lives. This is also critical to remember. Very often I joke with my students, and the nature is really great here. Maybe you like mushroom picking. I always say to my students that people are like mushrooms. You think that a mushroom is an organism, but actually it's a different thing, because a mushroom is something that is born out of the entire mushroom system, mycelium. Without connections, we will not survive and thrive. The second thing that I would like to share with you, why this collective part and collective mechanism is so important for resilience. It will be explained by the science of anthropology. When we had the exams to enter our institute, we had this question, and I would like you to answer this question as well. So you need to select in what country or social group we have the lowest indicator for depression. So we had Finland, number one, the rating of success. Switzerland, the US, they have very many psychiatrists there, and also some tribes, Gaza, San, Tanzania. So what is your answer? What is the country? The last one, right, absolutely. They have extremely low indicator, and we can see how important it is to understand anthropology behind it. Our nature is that we need only a mom and a dad. We also need a tribe, and quite often we forget about that. Sometimes we think that I just need a partner, or I need a mom, or I need a dad, and that's all. That will suffice. But it doesn't really happen that way. We need a tribe. This is our nature, to have a tribe. There's another important concept that we have in anthropology. Mankind evolved thanks to allo parenthood. It means that we have wider family, extended family, uncles and aunts, because in primates, monkeys, they don't really have grandparents, like grandmothers do not raise children. So Oksana, if you are already grandmother or plan to be a grandmother, you know how important these people are for the evolution, because actually a grandma took care of grandchildren, and it means that there were more children in the family. But we also need teachers. We need scout teachers. We need a tribe, because we're all limited to some extent. We cannot cover all the areas, and we need to set these examples. Tribe is needed not only for children. This is also a need of adults. So I would like to refer to Gaza tribe. There is a child psychiatrist who studied this tribe, and I read and learned a lot from him. So there is a very interesting fact that I discovered. Our Polish colleagues compared the level of happiness in this tribe and the Poles. So who is happier? What do you think? Gaza tribe is happier, absolutely. And in older age, there is a significant gap. So actually, Gaza tribe are way more happier when they age as compared to their Polish counterparts. Well, we do not have these studies for Ukraine. I do not want to idealize. I don't really want to say that we need to regress and to live in woods to be psychologically healthy. This is not what I'm saying. What I'm saying that in these tribes there is something extremely interesting as far as relationships are concerned, because this is something that actually reminds us of secure attachment. It's very similar, but you multiply it by 30, 40 people. If you hunt for something and you didn't catch anything, people will share it with you. It's not that people will eat what they got, but they will not share it with you. There is mutual care and understanding. If you want to think that you are wiser and that you are more important, that means putting a crowd on your head. They have anti-narcissist practices in these tribes. They will start poking, making fun. Are you really serious that you hunted for giraffe and killed it and you think that you are such a great hunter? No, it just fell like that. It was not because of you. Just to make sure that people do not get arrogant, they will deal with that. These extremely interesting issues that we are observing, it means that we all need a tribe. We can do much better when we have this tribe. I don't really want to say that we need to regress, but it's about community. A community is a model of a tribe. You know about Junger's book about community as a tribe, about dignity, mutual respect, mutual care, being honest, actually, knowing how to resolve conflicts. In God's tribe, they do not tolerate hostility, because if there is any hostility, they will try to actually manage the situation. They cannot really live if there is an internal conflict, because it can be detrimental to the way they live. That is why there's a very important question that we raise here. If we know that a community is an answer to finding resilience, how do we become a community? I listened to the presentations before. This is what my colleagues already shared. They presented their achievements already. How do good singers become a choir? It's not that they just get together and start singing. You cannot have a great choir just like that, Of course, it's important to have, great singers, because if people are bad, it means that the choir will have a very limited repertoire and the singing will not be good. We need to have a diversity to have a great choir. Then if you want to have orchestra, it means that we need even more talented people. But if we just gather these people in one room, it does not guarantee that the song will be great, right? It's very important that they are united by something. And the logo for the school, just take a look at that. We can, yes, the symbol that you can see maybe is a human, or the letters U. They are not chaotically united. They build something together, something beautiful. So we need to have shared values. We need to be inspired by something. Also, it is about coordinated, concerted effort. Also, it is about shared mindset, and also about us trying to understand each other through building a connection. It's not us being separate individuals. It's us shaping, forming this unity, and achieving something greater that we can do individually. Let's consider these components right now. The organizers asked me to provide some examples drawing on the Ukrainian culture, elaborating on that. Well, I never had this expectation being a child psychiatrist to speak about the Ukrainian culture, but I'm so fond of Ukrainian culture, and I'm so grateful for this opportunity to also speak about the Ukrainian culture. We know from the studies that when people understand their senses, it gives power even in times of challenge. All resilient people, they have a feeling of sense. Let's think of Viktor Frankl and examples from other studies. All these people, they know about the meaning of their lives, right? These senses, and they do not lose it even in turbulent times. That is why it's not really about some intellectual form. When we speak about values, what would be the best metaphor for values? I think that one of the best metaphors for value would be that it is music of our heart. It's not that somebody has to like or agree to the music of your heart, right? But this is something that you find so touching and moving and inspiring. And when we hear this music and you know that your heart is beating, you start singing, dancing. So it really it is really about this energy which translates into doing. So it's about the spiritual part, not in a religious sense. It's about inspiring. This is something that gives you strength. That is why values are about being inspirational. We find the source of inspiration and we get inspired. We need practice for that as well. I think that one of the most important things as far as the Ukrainian culture is concerned is us singing, because we sing and we get inspired. I asked my grandmother, what did you do when there was no power? And actually we know that in our case it's forest, but in older times there was no power in villages, and she said that we would get together at somebody's place, sing together, talk, and then I said, but when you went somewhere far away to God, somewhere, what did you do? And she said, well, we sang on our way. I think that this is something that is very organic. I don't want to say that songs is the only thing to get inspired. There could be stories, beauty, culture, which we also find inspiring. Prayers can also be inspiring, but I think that a song is a great practice. When the full-scale invasion started, we had the summer school initiated by the Ukrainian Catholic University in their Carpathian area. They also had an agenda, but they had some evening activities, and we started singing. And it's so nice when there are many people gathered together, and sometimes people know different songs. Sometimes you can learn something new, and sometimes these are the songs that you know. And also in this digital area, it's really lovely with songs because you can always find the lyrics of the song. We had been singing for 5 hours. No one was forcing that on us. We didn't have a moderator. There was only Oris playing the guitar. We didn't have anyone making us do that. But I know that when you listen to songs and you listen to these songs, you think about the voices of those people who already passed. Your grandmother singing this song at a wedding reception. It's about the centuries. These are the songs about love, motherhood, all kind of songs. But you can feel how it enters you. You can see the landscapes. You can feel a different kind of strength. That is why I believe that it is so important for us to sing for our resilience. It's important for us to have these deep roots in our culture. What is culture about? It's about cultivating a person. It's about presenting us with depth and meanings. We will have this robust resilience when we have deep roots, because sometimes culture can be not life-sustaining or life-giving, because in the Russian culture it has a decorative nature. It's not about cultivating something. It's about them thinking how great of a people they are. This is not the part of the culture, because the key feature of culture is to make sure that a human is a human because of this culture. And if it doesn't perform this function, then this is not culture. And we have this revival of culture. We have so many names, poets, songs, and all that right now. It's so important for us to get inspired in different ways. So the first one was to get inspired. The second component is to act and to co-create. Whenever we face a challenge, act. we know that's really important. Well, Franco spoke a lot about work and its important. Singing and working, two great powers, and it's about co-creation. It's about the potential of co-creation, which is immense. In our culture, we have a fantastic example. And we have an interesting phenomenon. In Ukrainian, it is called taloka. It's a practice of joint cleaning, right? This volunteer community work. Subotnik is a Soviet phenomenon. When they forced people to do something together, it was part of my childhood in Soviet times. The Loka, this community work, is different because it's about working together. And actually, I remember it when I was a child. They would do that in villages, getting together and building something together. It was not about earning money. And for example, if my grandfather needed some help to build a barn, people would get together and make this barn, and they would celebrate when they had it built, and they sang together. It's about leaning on each other. It's about this common cause. Or when there was a fire in the village, there were lots and lots of people passing buckets to make sure that they can extinguish this fire. And actually, they managed to do that. And that was faster, actually, than with the help of firefighters. My grandmother remembers how it was when their house burned down, and there were 5 of them. And actually, all the neighbors built the house anew. Each neighbors took care of one child, and it was not about them wanting something in return. This is how it should work in this world. And then after some period of time, they had a new house built. And yes, we were separated for some time because of what happened, because of this fire, but then we got together. That is why the spirit of co-creation, joint activities, efforts is part of partnerships, but it's about our solidarity and generosity. There is another thing, another example that I would like to provide. In Sumy, there was a missile which hit a university, and our university, the Ukrainian Catholic University, donated a very significant amount of money without any expectation to give it back. And just by accident, I learned about that. And that was a big amount of money, and we have many needs. But this is such a great example of solidarity, that the Sumy University is not a competitor. It's another university, and we're a network of university. If something happens to our colleagues, it's important that we support and that we have. It's about volunteering. It's about many things that we have in Ukraine. Resilient thinking. I think that Natalia already mentioned how important it is to have collective thinking. We know that very often it's about our vulnerability when we live with a mental disorder, and sometimes we can have this blurred mindset, so to say, blurred vision. Yes, these things happen, and we can get too pessimistic. We can start catastrophizing things. And resilient way of thinking is when we are united. We draw on our values. We try to get realistic about the assessment of the general situation, and we try to reflect on that. We try to take stock of the situation. We try to think about solutions, managing the situation, dealing with the situation to the extent possible. That is why when we have resilient thinking, it leads to hope, because it's important for us to have the plan, to understand the foundation that you stand on. We have this saying in Ukraine that 2 hats are always better than 1 hat, right? And it's always about us reminding us that we are all limited. It's always better to have somebody else than just to rely on your own. That is why when we sit together and we think together, and in our culture we have this what we call basada, a conversation, but it's not about political debate or anything of that kind, because political debate is absolutely different. It's about people trying to prove that they are wrong. But when we have a conversation, we get together and we listen to each other's stories. It's not about us being experts, sharing our expertise. It's about us being together, sharing these stories, reflecting, asking very profound and deep questions. This is true, authentic, deep conversation. And this culture of conversation is in need of cherishing because it leads to resilient thinking. That was this joint thinking, just this co-thinking. Emotions is another aspect. They play a crucial role, especially in times of challenge. We know that emotions are about energy, which mobilizes and streamlines our mental processes to run away from the danger. That would be the best way out, or to fight. That could be another reaction. And also anger, it makes us more resilient and stronger. We know how needed these emotions are.
Це тоді, коли
We know that the resilience is destroyed when the emotions are like fire. Fire may give us life and food, but it may also cause, something to burn. And when this anger, actually exceeds and crosses the boundary and it destroys the others and myself, and then anxiety may lead to paralyzing fear. So, what happens to the emotions in a community or in life-giving relations? This is called emotional co-regulation. Very simply put, they say in Ukrainian that when you share your pain, it decreases. When you share your happiness, it multiplies. So, pain will probably not get, easier, but you have someone to rely on. And this is a different experience of surviving pain in comparison to, surviving it alone. Look at military funerals or, other cases when somebody dies unexpectedly. I remember the funeral of the Basilevich family. There was this missile strike in Lviv, which resulted in 3 family members, a wife and 2 daughters, dying. And I remember the grief of that father and of the family. And it seemed like everyone who could come came to this funeral. And people put on embroidered shirts and they brought sunflowers. And everyone was grieving quietly and deeply. But they were side by side. And by coming, and not coming defeated, but coming in this, with this memory, with these sunflowers, with the embroidered shirts, saying that we will remember them, that we will remain good and bright people. This is what we do to co-regulate pain. Our student and graduate, Alex Sherman, he died and he was buried in a village. There were thousands of people approaching his mother and hugging her. This is co-regulation of pain. And the same is about celebrations. We know how important celebrations are for resilience, how important it is to share your joy and happiness. Joy and grief are intertwined during the war. And I would like to summarize here that yes, the power of the community is in each separate person, just like the power of a choir is in each singer. But for a choir to become a good choir, for a community to be good, it means that we need to be like-minded. We need to have unity in values. We need to get inspired by that, and we need to cherish the relations. Shevchenko speaks about loving their brother. So we need to act together, think together, be the people of hope together. And a community is the response to these extremes. We are very intolerant to totalitarian unity, collectivization, but at the same time, starting from 1990s, we saw this so-called Ukrainian Wild West, when you cannot trust anyone and everyone is only responsible for themselves. This is not an option for us either. So the community means that community is important and joint responsibility is important. The community is this golden mean which creates Ukraine and gives us a chance to become a diamond. So how is it related to mental health and the topic of health in general? Because this is a school about health. I think that it means that we should not just have a nice vision and use good mottos and I don't know what alcohol policy we have here, but when you drink in Ukraine, we say, well, let us live. We will survive no matter what. Budmo. So. If we can do it today, probably even if the circumstances allow. So we can do that with our everyday activities. We have to cherish our communities everywhere, and the next task is to build bridges between these communities so that Ukraine becomes the community of communities. We need to create this network of partnerships. We have to be conscious that this is a very difficult task. Since despite the fact that there are so many beautiful things in Ukraine, but we also have a lot of social problems, and we should not think that we are always wise and everything is very good. We also can be enemies to each other. We can be not empathic to each other. We'll enter a confrontation. Think of ourselves as being better than somebody else. There are so many other problems. And, as Joseph Slipy said, that, we all left the USSR, but the USSR has not left us completely yet. Well, because totalitarian system destroys trust and self-esteem, and that's not surprising that it was replaced by the wild 1990s. So we need to be very good at diagnosing, and we need to understand the treatment. It's not just a medical or psychotherapeutic thing. We need social therapy as well, and I think that our revolution of dignity, as an example, is a very good example of what healing is about, and has to continue because it has just started. This revolution of dignity should continue. The reform of system, for example, of the healthcare system, it's not only about the documents formalizing some partnerships or agreements, but it's also about the spirit of solidarity and cooperation, which lives not in the documents, but in the people who build the solidarity and collaboration. What does it mean in practice? I invite you all to think about the things we've been thinking about for our whole lives. What does it mean to build a community, to build a partnership? I think that at different stages of our lives, this means different things. And even when we face some bad things, they still let us some hints. Give us some hints about what needs to be done. I will put down several points, what it means for me in my life. For example, when I became an intern, that was my first day in one of the big hospital. I thought that the hospital would be very happy about my coming there. Well, at least people will say hello and will welcome you to the community, because I grew up in a culture where it was a norm. And I come to the office of the head of the department and I say good morning, and he doesn't say anything. I wait for him and I tell him, good morning, I'm a resident and I came here because I was sent. And he doesn't respond to me again. And I thought maybe something happened. Maybe a child died in the hospital in this department or something. And I ask other doctors, why is he not talking? Well, what is the problem? And they say, he's okay. They say, he's just showing you who you are. And I just wanted to draw it as an example, because if we want the healthcare and healthcare education to, develop the relations and communities, it's a very simple thing. When somebody comes to work with me, I keep recalling that I take this person with me and I introduce them to everyone. I want everyone to know that there's a person who's going to work with us. She's somebody's daughter or he's somebody's son. They will be a part of our team. It's not about some big team buildings with super facilitators costing a lot. It's just about, saying good morning, asking people how are you, listening to each other. These are very simple things. this is all about the team. In Colosimiei Center, where I work, we start our day by sharing how we feel, and it takes time. And people may ask, why do you do that? But we need to understand each other because, somebody's husband is fighting at war, somebody's grandma is very ill. We're not robots who are just doing their job. We don't spend an hour talking about our mood, but if we know that somebody's husband has an oncological disease and they need expensive treatment, we will actually raise money in our team, but we will never know about it if we don't ask each other about how we feel. And I'm not even talking about the important moments, like when we are together at sad moments and at happy moments. The same as with the students. When they come to my lecture, I usually tell them, we have special devices here in this lecture room, which actually take off the crown of your heads, because it's very difficult to build community without humility. You need to learn to serve the community and not fight and compete with each other. So this is also about creating the culture where the word humility is so important. And it's also about creating the culture of partnership. For example, when someone creates an organization, when somebody tells us, well, they are your competitors, when I learn about them, I write them a welcome letter. I want them to know that I want them to be successful and to thrive. I don't want them to think that I see them as competitors and not as partners. If somebody asks me how to create a center of mental health in the community, I tell people, come to me, I will show you and I will tell you, and it will not cost you anything. I know there's knowledge you have to sell, and that's okay, but when you're generous, it always comes back to you. Well, when you share, it comes back to you. The Soviet Union destroyed this trust. They actually created the system of stinginess. When I'm not sharing with anyone, but the culture in the community is always about the culture of generosity and support. And when you're teaching someone, you have to remind them that education is not only about the knowledge, about the mind, and about the skills in the hands. It's also about the heart. It's about the ability to build relations and live by certain values. So now, to conclude, I would like to remind you that we started by sitting down in a circle around a fire. And now I would like to finish on a peak, because summer is a very good time to go hiking in the mountains. And mountains are very good places where you can see all around you. And, you can take a kind of a detour or something like that. But there are three very nice roads. One is the road of resilience, and we understand that we are creating the whole culture of resilience. We are cherishing the practices of resilience. We understand the importance of culture, family relations, and the system of care for mental health. There's another way. That's the way of community. Whether we like the word community or not, it doesn't really matter. It's the importance of the team, of relations. And it means that relations are always about work. They don't just happen by themselves and by accident. Someone has to create this space where we can sit down in a circle and we can see and hear each other and sing together and do something together. This is about the word. The president of our university, Boris Hudzak, spoke to the freshmen, and he told them that I do want you to learn to use two words during your studies in the university. If you learn to use these two words, then it will mean that our university has already accomplished its huge mission. And these are the words, thank you and forgive me. These are the words which help us build the community and relations. And we need leadership there. This is what the president of the university tells to the students. So somebody has to tell this and has to behave by these words every day. And the third road, this is the road of bridges which unite us all. into a community of communities. It's not like one person is a fortress of resilience. So we are a big network. We visit each other. We celebrate, we share, we have joint projects, and this is the only way how we can create the good system of care for health. And Marina encouraged me to make a present for you in the end. And well, she said maybe find some publications or something else. But I thought I would make a present which is not material, which is not tangible, but because intangible presents are also very valuable. And I would like to make a present of words. These words come from Africa, where the humanity actually appeared and spread all over the globe. And they say that if you want to walk fast, you have to walk alone. But if you want to get far, you have to walk together with the others. And I really like this word far, because you can go somewhere, but if you want to go long distance, it's very attractive. This is something you can see from the mountain peak. It's not just about some initiatives, reforms, protocols. These are important details, but when we speak about long distance, this is about living in a healthy world where people have healthy values, where health is their value, mental and physical health, where we live in a world which is actually moving towards real health. Not just health which is free of diseases, but where people are flourishing, and people can only flourish when they are in good relations with other people. So it's about the flourishing of human relations, and it may seem unrealistic, like a utopia, or we may be asking ourselves, can we ever get there? Can we ever be there? But we actually may have it here and now among ourselves, when we have good relations, when people are kind, where we have this place which is the source of power and strength. But there's a risk of never getting there. It's like this portal which can only open when we go there together. But sometimes when we go somewhere together, it's a burden because we quarrel a lot, and this is not a real community. But when we walk as a community, this portal may open. And for it to open, it's important for us to learn to build this community, to remember about our strength, and to go there together. I wish you a very good time at this summer school. So let's go long distance, and let's go there together as a community. Thank you. That was a very inspiring lecture. I made a lot of notes for myself. I hope that you used your workbooks as well. And before we proceed to our next collaborative action, we have heard about very nice collaborative practices which are characteristic of the Ukrainian community of communities. So I would like to ask you to think about one thing, one idea you heard, and the one which you would like to have more space for, to, give it more thought. I mean, something we have heard from Mr. Lech Romanchuk. So just think about it for a minute. And then after you do that, please share with the person sitting to the left from you. 1 minute to think about it. But please don't share yet.
Друзі,
So now we will transition to the next joint activity. Yes, so let's have the reflexive part over. And now I would like to invite Maria Oneshak to join us. An artist, singer, actress of the Lviv Academic Theatre.